Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio today. According to the Centers for Disease Control, 1 in 8 couples, or 12% of married women, have trouble getting pregnant or sustaining a pregnancy. Now, in addition to that, approximately a third of infertility is attributed to the female partner, a third attributed to, of course, the male partner, and then there's a third that's floating around caused by a combination of problems in both partners or simply called unexplained. Our guest in studio today is Mary Wong, traditional Chinese medicine practitioner, founder of Alive Holistic Health Clinic in Toronto, Canada, and the author of the brand new book, Pathways to Pregnancy, Personal Stories and Practical Advice for Your Fertility Journey. She's here with us to talk about some of the common causes of fertility and how to ready oneself to encourage pregnancy. Welcome to Health Professional Radio, Mary Wong.
Thank you for having me, Neal.
Thank you. You're a fertility expert. You've got 20 plus years of experience dealing with couples as a holistic practitioner. You're the founder of Alive Holistic Health Clinic in Toronto, Canada. Talk a little bit about your background and how you gravitated toward fertility of all specialties.
Well, it was by coincidence, by fate, by accident, not sure which way to go, but my professional domain is as a traditional Chinese medicine practitioner. And as such, we basically treat a lot of different various types of problems because Chinese medicine is a whole medicine. However, my own personal interest was geared also towards fertility because I knew for myself I would delay trying to conceive, having a practice, running a practice, and just where my life was going at the time. So my interest was very keen, and when we were also treating women with fertility challenges, it was something that we were really good at doing. And in Chinese medicine and acupuncture, we're really good at working with fertility and pregnancy and beyond. So it just grew over time from the work that we've done through word of mouth. Back in the day when it was word of mouth, now it's by internet. Mm-hmm. But that's how it all started out.
You mentioned kind of a whole approach to the fertility issues, but are other services offered there as well?
Absolutely. So we have, between myself and the rest of the group, there are 4 TCM, traditional Chinese medicine practitioners, mm-hmm. and 1 registered massage therapist that does what we call our Vigo Mayan abdominal massage. Mm-hmm. And that is really fantastic for fertility as well as any kind of internal issues. And then we also have a hypnosis practitioner, and in our clinic a lot of it is for fertility.
You've got a brand new book out called Pathways to Pregnancy. I mentioned we were going to talk about some of the causes of infertility and fertility, but I also mentioned you want to teach us how to ready ourselves to encourage pregnancy.
As you had mentioned, 1 in 8 couples have issues. It's actually more, 1 in 6 have troubles in a lifetime. And that is a very common problem, yet it's such a private issue, no one talks about it. So I want to be able to reach out and help all those couples that are trying to conceive or even thinking about conceiving one day, and simultaneously to dispel the shame that often goes along with infertility and just providing a voice for all those that are suffering. And the second piece is that I want to say that there's no one right way of doing it. It's not one cookie-cutter method. There's lots of pathways towards pregnancy, hence the title of my book. And personally, I found that there's a lot of gap in advice and support. So I wanted to give really practical advice coming from research, coming from my personal as well as my clinical experience. Mm-hmm. That will really help empower people to say, hey, yes, we can do this.
Is your audience more of to women as on their fertility path, or is this something that, us guys can actually get into and understand?
Here's what's very interesting. So I did a little feeler out to my practitioners in North America, and I said, hey, just out of curiosity, how many of you are treating male factor fertility? Because as you had mentioned, males are equally likely to have fertility issues. Mm-hmm. And what came back was, 5%. So men just are not really ready, open, or willing to pursue fertility treatments, typically. And I'll say even further that in there's like a common myth as though that infertility is a woman's issue, and yet really men are equally likely to have fertility issues. But, there is such a stigma around that as well. I think, as if you think about a man, there's this whole association with, I am man if I am virile. So if you are not getting pregnant, sometimes I have witnessed that the men are in fact unwilling to even go to a clinic to get tested. Just, maybe that unwritten rule of, I'm okay, but yet we don't really know.
Yeah. Surrounding a stigma is a huge shell of just misinformation and being uneducated about certain things. What are some of the more common causes of infertility? I guess once we get it out there in the open, then maybe we can be more readily able to address it.
Yeah, and it's wide and varied for sure. And I do spend one chapter on male factor infertility itself. Mm-hmm. And so let me start with the men, okay? Mm-hmm. So, things even like cystic fibrosis, so actual predisposition, certain genetic components can impact fertility. Or, cancer in the past, you've done chemotherapy or radiation, that can impact sperm in the future if you're young. Even the lifestyle, I mentioned that. So if you are any way obese or even just overweight, that can impact your quality of your sperm. What you eat, how you eat, that impacts your sperm. If you at any point over time increase your scrotal temperature by even a mere 1 degree, that can impact your sperm.
Really?
So there's lots of different things for male factor. So and that 1 degree thing, that's why we say don't put your laptop or your computer near your scrotal area. And or saunas and hot tubs, those kinds of things. We don't want to be immersed in that too much either, because that can impact your sperm. The good news is that when it comes to these lifestyle factors, it can change. And a male sperm cycle is about 72 days, so you can produce a new batch of sperm, and it can be in a better place. And I've seen, for example, a man who was smoking marijuana for 10 years straight, had horrible DNA fragmentation in his sperm, and his sperm count was okay, but they were all messed up. So in the end, when he quit smoking for even just a month, when he went back to get retested for his sperm assay, it became normal. So it was astounding.
Just that simple lifestyle change.
Exactly, right? So, and then for women, there are definitely lots of other things as well. So, I always say be proactive, get tested for things like endometriosis, polycystic ovarian syndrome, and blocked fallopian tubes, and that can be caused by endometriosis or STIs, things like that. There can be even diabetes in the family for both men and female. That can impact it. Thyroid issues. So those are the most common things. And of course, you know what? I cannot overstate this. There is an actual age factor. However, it's not hard and fast.
Where can our listeners get a copy of this brand new book?
So you can go to Amazon.com or any bookstore near you. And you can also check out my website, marywong.life.
It's been a pleasure speaking with you, Mary. I'm hoping that you will come back.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Mary Wong, traditional Chinese medicine practitioner, founder of Alive Holistic Health Clinic in Toronto, Canada, and also the author of the brand new book, Pathways to Pregnancy, Personal Stories and Practical Advice for Your Fertility Journey. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.